Last year, $14,570 per person was spent on healthcare in the United States, totaling about 17% of our GDP, and was nearly triple the cost per person compared to other developed nations. As of right now, 1 in 3 Americans has medical debt, 1 in 5 Americans are past due on those bills, and 1 in 6 Americans has had medical bills sent to debt collectors, totaling $194 billion in active collections. And depending on what source you choose to trust, be it universities, private research companies, or the government, take your pick, Americans being underinsured or not seeking medical help out of fear of debt has led to anywhere between 25,000 and 80,000 avoidable deaths every year since the 90s. Which, on average, is like the United States experiencing another Vietnam War every single year. The healthcare nightmare of the United States is an economic, social, and national security crisis that you are likely carrying the burden of. Last year, the annual premium for employer-sponsored family insurance plans was $25,572, up 65% from a decade ago. Now, if you don't know, your premium is the amount of money that you pay for the privilege of having insurance at all. And typically, your employer covers a majority of that on their end while taking the rest out of your salary, which is a big part of why American companies might say that someone's total compensation package is $85,000, for example, despite their salary being $50,000. They're still paying $85K a year to have you as their employee, but if you were told that you make $85K and then saw a few extra $1,000 get ripped out of your paycheck every month for company insurance, you would freak out. Because mentally, it's easier to cope with the idea that you just make less money than it is to cope with the idea that 2/3 of your annual compensation is taken away from you for taxes, benefits, and most of all, health insurance. I should also throw out that this is a major reason why wages haven't caught up with productivity, because it now costs companies tens of thousands of dollars more to insure the same employee on the same salary as it did a decade ago, but that's a whole other video. So right off the bat, we already have a problem with how Americans understand our insurance costs, since over half of that cost is secretly hidden from us behind HR jargon and psychological manipulation. But it doesn't stop there. That's just the cost of having insurance. Here in America, you then have to hit something called a deductible every year before your insurance actually kicks in, which is the amount of money that you pay out of pocket before your insurance starts covering any portion of your medical bills. And that amount typically ranges from $3,000 to $5,000 a year for US families who don't work for the government and aren't receiving Medicaid. So these are healthy people employed by private companies, which again is yet another psychological trick to stop you from freaking out about how much money you spend on coverage. At the end of the year, this is the exact same thing as if your company took an extra $400 out of your paycheck every month for insurance. But because it's labeled as a deductible in America, and because you're paying that on your own instead of having it taken out of your check, you think you're much better off than you actually are. But let's play this out for a normal young family. Depending on your state, the median household income is somewhere between $40,000 and $90,000 here in the US. So let's say that you are a young couple with one child living in Omaha and that you make $60,000 a year at a small private company, putting you quite literally in the middle of the country in terms of income and expenses. If you have the default 401k plan, then $6,000 of your salary gets put into retirement, $6,700 gets paid in federal taxes, $2,400 goes into state taxes, another $4,500 goes to Social Security and Medicare, and since you're at a small private company, let's say that your employer covers half of your insurance premiums, so you then pay $18,300 to cover you, your wife, and your kid before your insurance actually starts footing any of your medical bills. In total, it costs you $39,000 or 65% of your annual total compensation just to have insurance and a retirement account in this country. And yet we talk about Scandinavia like it's this hellscape of taxes when they're only losing half of their total compensation for all of the same stuff. If you want to have a wife and kid at home, then it is more affordable to live in Stockholm on a median salary than it is to live in Nebraska. And so it's not that the American dream is dead necessarily, it's just impossible for the middle class to achieve anymore. Even if they're in Omaha, a family of 3 can't survive with only $21,000 left over for the year. If they live in a duplex, then they're likely paying $21K a year in rent alone, let alone groceries, car payments, clothes, Fortnite V-Bucks, student debt, and everything else caught up in American family life. And that's exactly my point. The obscene amount of money that we spend on privatized insurance in this country means that we have to make very difficult trade-offs in order to survive. So what do? Well, if you're a lot of people, then maybe you don't contribute to a retirement account or savings in order to hold on to that extra $6,000 a year. But good luck ever buying a house, and good luck surviving after you're 67 years old. Maybe your wife goes and gets a job. That's increasingly become the norm in American households over the past few decades. But have fun paying over $1,000 in daycare every month, likely needing to own a second car, and having to do all of your household chores at the end of the day after both of you are exhausted from going to work. Maybe you decide to move to a coastal city and get a job that pays over $100K, but have fun with insanely high state and sales taxes, traffic, risk of violent crime, and increased competition at work from simply having way more people around. So here's a question for you, young American adults. Do you want a stay-at-home spouse? Do you want to have a kid? Do you want to own a home? Do you want a comfortable retirement? Awesome. Pick 2. You can absolutely have 2 of those things if you are working the median full-time job in this country. For example, you can totally own a home and have a kid if your wife also goes and gets an adequate job. Just don't feel bad when your buddy doesn't have to pay for a second car or daycare costs because his wife chose to stay at home. After all, they live in an apartment and you live in a house. Everyone is able to have some of the American dream if they're willing to work a full-time job and put in the effort in order to get married and cohabitate. We just can't have all of what our grandparents had anymore. So while things like wage stagnation and housing inflation since the 1970s absolutely played a role in killing the American dream, it is privatized healthcare that then goes into the graveyard every year and dumps another pile of soil on top of the American dream in order to stop it from clawing its way back to life. Right next to the 50,000 people who died every year because they were too scared of going to the hospital because of medical debt. Look, we cannot deny that the numbers prove Americans are getting screwed by healthcare costs. Business analysts, university researchers, government agencies, and even the most hardcore Republicans all agree on this. But we are too scared of a system that we perceive as anti-capitalist in order to move this country towards anything better, ironically pushing ourselves even further into poverty as a nation and consolidating even more power into the hands of politicians and CEOs and away from the people. You know, kind of like how the Soviet Union was during the Cold War. So let me be real with you for a second. My education and professional background is in economic history and political violence. I know that the economic revolutions of the 20th century under the banner of communism led to widespread genocides and suffering in places like Eastern Europe, Cambodia, China, and Peru. And baby boomers, understandably, remember those atrocities incredibly well, which is why they are so scared of anything that they believe goes against free market capitalism. I get it. However, privatized corporate insurance does not work and is making our markets and our country less and less free every year. It does not competitively regulate prices, it does not encourage innovation, it does not bring down ER wait times, and don't worry, we'll get to the myth of wait times in Canada and the UK here in a minute, and it absolutely does not make the United States a free and desirable country to live in for the Americans who are already here. We, the people, are suffering because of privatized healthcare. And it's time that all of us really take a minute to understand that rationally. No emotional appeals, no stories of Americans drowning in medical debt, no Democrat versus Republican bullshit, just good old-fashioned numbers and business sense. Because you just might find that leaving insurance payments in the hands of the government might ironically make free market capitalism work even better, save both citizens and businesses a ton of money, and help restore the American dream. Crazy, I know, but hear me out. Universal healthcare will help save both big businesses and entrepreneurs tons of money and staffing issues. Back in September, I officially quit my job and became a full-time entrepreneur at 29 years old. And while that was incredibly exciting and freeing, it also made me realize just how much private healthcare tries to punish people who leave their jobs in order to become business owners. My last paycheck came in the first half of the month, so if I wanted my wife and I to have insurance for the following 2 weeks while I waited for my new personal insurance to kick in, I would have had to pay nearly $3,000 in COBRA insurance in order to guarantee that coverage. Not only that, but I'm also in the process of doing Invisalign because I grew up poor and never got braces, and now I have to pay the full expense for an orthodontist out of pocket because privatized insurance plans don't cover treatments in progress. None of this would have happened on nationalized insurance, and I fully understand why so many ambitious and hardworking Americans psych themselves out of becoming entrepreneurs because of the insurance nightmare that I just had to endure in order to become an entrepreneur. But forget about individual people, let's bring it back to large companies trying to insure their staff. Last year, employers paid an average of $7,584 for every single unmarried employee that they had, and $19,276 for every employee they had with a spouse or child. And while employer insurance premiums do come with tax benefits, so do the wages, retirement benefits, and every other part of total compensation that you are paying for workers already. The fact remains that American companies are still paying 3 times as much money in order to insure their staff as companies in other developed nations that are just as free, just as educated, and just as capitalist as the United States. So even though large companies can join coalitions, like the Pacific Business Group on Health, in order to negotiate insurance costs, they're still only paying about 10% less than small companies that don't have that bargaining power. Ironically enough, the only organizations that seem to have any real bargaining power against the insurance companies are governments. Because of their sheer size and power, government entities are able to use procurement laws and scale in order to drive down insurer margins and admin costs, making it currently 20% cheaper for the government to insure their employees on the best possible plans with the most coverage relative to corporations. You have my apologies for going full MBA lecture on you there for a minute. I was a college lecturer until like a month and a half ago, so the habits die hard. But another way to think about this is that even the most rich and powerful mega corporations in America are still getting a worse deal on insuring their employees that government entities are. And so if the biggest and wealthiest private companies can't even bargain for a better deal with insurance companies, but the government can, then which organization out of the two do you think is better equipped in order to drive down healthcare costs in this country? It's the government. Not to mention the fact that ensuring the health and safety of the citizenry is literally the point of having a government that we pay taxes to begin with. So if you're not opposed to the government running the military, then you shouldn't be opposed to the government running healthcare either. Now, this is the part of the video where people are going to run to the comments section and say, but hey, what about all of those wait times and efficiency issues in places like Canada and the UK? Sure, my insurance costs 3 times as much as they're paying for it, but at least I get seen at the ER right away, and I know that I can pay my way into basically any treatment that I want. Well, I've got some bad news for you. The idea that other countries' medical services are slower and less effective than America's is almost completely 100% wrong for virtually every medical service that a normal person would receive. The only recorded instances where British and Canadian people are worse off than us in terms of healthcare are for services called elective care. So we're talking about things like optional procedures performed by a specialist that have the ability to be delayed by several weeks. So yes, if you need a knee replacement, you're going to get it faster in the United States. But if you need primary care, the emergency room, mental health services, or other random stuff like a cardiologist after a heart attack or an OBGYN in order to give birth to a baby, then you're going to have the exact same wait time and quality of care in most other developed nations as you are in America. Except they are going to walk out of the hospital without any life-ruining medical bills. And you are going to have to wait for your doctor to argue over the phone with an insurance company that's fighting tooth and nail to deny you as much coverage as they possibly can. And what can companies do when their employees are denied the health coverage that the company is paying $25,000 a year for? Virtually nothing, because companies can't enforce the rule of law. But you know who can enforce the rule of law without getting screwed over by insurance companies? The government. It is completely unacceptable that we tolerate living in a free country where you effectively have to become a debt slave to a private insurance company just to have a baby or not die of appendicitis. And it is ridiculous that we are losing 2/3 of our annual total compensation just to have the same opportunities and benefits as people living in far more restrictive countries than the United States. You, as a citizen, are an active participant in capitalism and the Republic of the United States, whether you like it or not. And so it's time that you demand that your country give you a better deal. In the description, you will find links to contact your local representative in Congress, the person that your community voted for and who has the most power and authority in order to secure universal healthcare for you and your loved ones. As of recording this video, the United States government is currently shut down over a debate regarding insurance subsidies that wouldn't even have to exist to begin with if we had universal healthcare, where you have some representatives on both sides of the aisle fighting for a better deal for the American people, and then you have other representatives, again on both sides of the aisle, who are trying to continue lining the pockets of insurance executives so that they can secure donations for their next election cycle, instead of doing their job that we are paying them to do via taxes by ensuring the health and safety of the American people. America, we can demand better, which means that we should demand better. I'll see you in the next one.